I know our field is a little different, slightly different with naturopathic medicine, also depending on what, what state you're in and kind of your scope and all that, and also what your interest was when you went through, whether you kind of more specialized in like vitality medicine or nutritional medicine or physical therapy medicine or kind of general Western medicine with a naturopathic bent on it. And so we have all that whole spectrum in there. But I remember the conversation when when in kind of the lockdown started and you could tell that the virus was coming through. And I know you were this way, and I know most of the other doctors I've talked to is that we were treating the Rona since at least the earliest case I can identify was probably October 2019. And because it was just the exact symptoms until we just didn't know what it was called. So it was around for a long time. And we were treating people and sitting across from people unmasked and all of this stuff and all, or we're not wearing the face thing. So, and doing fine. And I actually caught it. But it was before I knew what it was like in December, and I recovered. I took my own medicine. But the idea was between whether you're going to have a bad response from, say, a current infection or not, would be a lot of those lifestyle factors. And those are like by far the main one. I know someone can always try to get a way off, like one in a couple 100 million example of like, well, this person seemed to be perfectly healthy and they still got it. So I still need to have fear. And I have an office full of patients that externally look perfectly healthy and internally are very not perfectly healthy, and they know it, but they don't tell everyone they know. So they often look, and usually in their 20s and 30s and maybe sometimes 40s, and they just putting on a good front because that's how they get through their day. And then our goal is to help them, feel optimal and get out of that cycle. But externally, all their friends think they're just fine. And so if there was someone who, because the idea is that every time that you go, wow, there should not be a big a fear response, then they try to go, oh, but did you hear about that kid that passed away from the, from the C thing? And then someone goes and looks, and that kid actually didn't, but the media ran with it. And I remember that was a big one where it was like I think it was like a 3-year-old or something, but there was a completely another reason, but it was promoted by the state and the media that they passed away, and that it was from something else to create fear in parents. Because again, the parents, every parent wants to protect their kids, and if there's a untreatable illness coming towards their kids, then that makes that parent feel fearful because it's something that they don't feel they can protect. So that was how they started, even though the kids have like asymptotically next to zero chance of having any morbidity from it. That fear is tough to shake once it sets in. Like you're saying, that fear has deep roots. So when you have a plant with deep roots, you need to dig deep. You need to get all the way down until you find the end of that roots, and then you pull them out. And then again, you keep an eye on it because it might come back. And if it starts to peek its head up again, you go back and you dig deeper, And so, but that's the idea is you can't just, when you're plucking fear out of your heart and your mind and your spirit, you can't just pluck it out once and think that you're done. You have to keep watching for it to come back. And then when it comes back, you pluck it out again. And if you need help, you go get someone to help you pluck it out. And so that's one of our jobs, is to help really break down and dispel that fear that has paralyzed so many people. Like there's even I was looking up some stuff on there. There's a philosopher from the 1800s, I think Burke was saying that no passion so effectively robs the mind as all its power of acting and reasoning as fear. And so the idea is that's essential for you to basically be submissive. And to submissive to things that you don't want to be. And so the goal is, for now, the country is still has a constitution and still has a Bill of Rights and things to try to protect our freedoms, but none of those necessarily protect your heart and your mind from fear. So so they protect your external freedoms, but that's where we have to be, for friends and family and each other, guardians of fear coming. And if you start to see that come, then you really need to. If you're capable of doing it, then you need to find ways of dispelling fear in one another, because that will also then help whatever that person's dealing with in their health life, go away, so then they can remove an obstacle. Because, that's a big part of, naturopathic medicine is removing the obstacle to cure is a pretty fundamental part of our kind of tenet and hierarchy in how we treat people. And so that's why, like, whether it's an autoimmune disease or gut infection or, neuroemotional issue or, bad menopause, is that we're looking for what are the obstacles that are blocking you from realizing optimal health and really getting that health accumulation. And so that's a big part of it. And so that's what I've seen because I originally, I on my website, I put Rona treated here in the first few days because it was, and I was having perfect success, and still have not lost anybody that I was working with. And I was treating people successfully before I knew that's what it was. But then I realized once the army of bots got activated, which I remember the moment when it did, I switched to fear treated here because really that's what we're treating.
Oh, that's good.
I can handle most of the acute illnesses can be handled in most people. I even had patients that had severe autoimmune disease. Basically body composition was far from optimal, and definitely your person you'd expect to have like the worst outcome and worst results. And they, with appropriate treatment, they recovered perfectly well, and they're doing great today. And so, and they even came in when they were fairly advanced in the process. And so again, will that work for 100% people? No, nothing works for 100% people. That's one thing I've learned. My physics degree, we dealt with probabilities a lot. And so there's a probability for everything, no matter how unlikely. There still is a level of probability for it. So you have to realize that there's danger in anything. So there's danger in getting in your car. There's danger in putting, eating food because you could choke. There's all kinds of dangers in things, but you choose to do them anyways because you realize that the benefit far outweighs the fear. So the probability of a negative event really needs to be put in context of the probability of a positive event. And so I think if you can, if as a person and a doctor, an individual, you realize that, okay, the probability of positive actions here outweighs the negative, then that also dispels the fear.
Yeah, that's good. That's a good one right there. The probability of a positive event versus the probability of a negative one. That's good stuff, Dr. Joel.
Yeah.
Super good stuff. So, Dr. Joel Noland, where is it that people can find you? If they want to, do a telemed visit or that kind of thing.
Yeah. So my practice is Sequoia Medicine, and you can find me at www.sequoiamedicine.com, SEQUOIA medicine.com. And you can sign up there if you want to do a consult or do an evaluation or need some fear dispelled. And so, but that's the easiest way to get a hold of me.
Because you can basically schedule your own appointment online, right? They can just
you can schedule an appointment or request an appointment. I have my staff. You can contact my staff, and they'll get back to you if you have specific questions.
Nice.
But you can fill out your paperwork online and then ask for an appointment that way. And so I moved to primarily telemedicine so I could spend more time with my family and whatnot, and also help people on a broader level. And so that's been working well. And although it's very important to always have an in-person doc available too, I definitely love working with people and being that extra voice of support and help, and maybe a third or fourth or 10th opinion to try to help you, chart your path and your course, navigate into your valley of hope and courage. So yeah,
it's great. Yeah. So we'll put all the information for catching up with Dr. Joel below, whether you're seeing this on YouTube or Spotify or Apple or wherever you're seeing this at. But yeah, Dr. Joel is a ridiculous doc, does fantastic work. And as you can hear, he has a very deep understanding of what's going on. And is really good at, explaining how things are working and how you're going to go from basically point A, which is probably a point you don't want to be at, to point B, which is hopefully way better. B is for better. And, feel like, okay, I can do this. And this is like the life I was meant to live. And this is the state of my body I was meant to live in. So Dr. Joel, anything else you wanted to mention? Any other good one-liners for anybody?
Well, I think every day be thankful for the people around you. And if you have family, be super thankful for them and realize how blessed you are to have them in your life every day. And whatever it is you have to be thankful for, take a moment and focus on that. And that's super important because, again, you don't want to open the door to fear. So, and one of the ways to not do that is to focus on the wonderful things and the love that's in your life and the love that you can receive in your life too. So I think that's a really important one, to kind of help put the shield up block the fear. So
that's good. That's health accumulation right there, people. Right there.
Yep.